Did you know that every 13 minutes someone dies from an opioid overdose? 2.1 million people have an opioid use disorder, and 80% of the world's supply of opioids is consumed in the U.S. Our next guest, Dr. José Calderón-Abbo, Chief Medical Officer for UnitedHealthcare Community Plan for Louisiana, has pioneered whole-body approaches to behavioral health in Louisiana and is currently developing a mind-body medicine model for addiction treatment. He joins us now to talk about the opioid epidemic in New Orleans and throughout the state. Thank you for joining us today, Doctor.
It's a pleasure. Thank you for having me.
And we'll be talking about a very serious topic, especially in Louisiana, about the opioid epidemic. How bad is it in the state?
What happens in Louisiana, this is data that we have from for America's Health Grades. That's looking the data from 2007 onward, and that we've seen a 46.5% increase in accidental drug overdoses in the state of Louisiana. And most recent data from the Louisiana Department of Health is estimating that we have about 105 prescriptions for opiates per 100 citizens. So that means that we have more prescriptions for opiates per citizen in the state of Louisiana. That's hard to wrap your head around. Yes, particularly considering that most people begin their addiction to opiates with a prescription, right? Or through their prescription, somebody else's prescription.
But I know UnitedHealthcare is trying to combat this epidemic, and one concrete example is something going on in Baton Rouge, which is what's called the GRACE program. Can you tell us a little about that?
The GRACE program is particularly tailored to address the needs of expectant mothers and their children. So aspects of stigma, of early diagnosis, of case management, referring to proper treatment, medication-assisted treatment for them and their children, it has shown better outcomes. So we're very excited to have this program with them.
Well, it sounds like a good way to start stopping the cycle of opioid abuse, but I know there's other ways to do so, and I know it's one of your expertise in terms of alternate treatments to deal with pain. I mean, a lot of people in America deal with pain and they need help, but I know that opioids isn't always the right choice. Could you tell us a little about some alternate treatments that you recommend as a doctor?
We need to align the expectations, use non-steroidal medications, and in cases for chronic pain, there's growing evidence for physical therapy and chiropractors, for example, to use, right? And then there's mindfulness too that people can access through apps and in other ways.
And there's also, of course, different therapies. Like you can even incorporate yoga, and even hypnosis, right? That could help pain.
Yes, guided imagery, hypnosis, absolutely.
And talking about dental work, I read some interesting statistics that most young people first get introduced to opioids through dental work and orthodonture and wisdom teeth extractions. And at that young age, I read that if children get exposed that early, their likelihood of taking opioids in the future triples. I mean, that's pretty startling, and I know it's also something that UnitedHealthcare is taking pretty seriously, right?
Yes, 10% of prescriptions for opiates in the country come from dental health procedures, but in the teenager and young adult, it's almost half of the prescriptions come from dental procedures. And we know that after 3 days, the brain begins to change. Young adults and teens, 19 years and younger, not to prescribe more than 3 days. But first and foremost, use non-steroidal anti-inflammatories as the first line of treatment.
That sounds like a lot of common sense, and I also know that there's another push for, in addition to the public awareness, producing TV and radio spots too. That's something that UnitedHealthcare is advocating for, to spread awareness. Is that right?
They are at the forefront of educating the public and providers, communities about the opioid use and alternatives that we can use, and best practices and what is needed. So they also do service in communities to see what are the barriers that we're having in this particular community, and then forwarding initiatives through education for the public. So that's very exciting.
But I know we were talking about treatment plans, and sometimes you say that you feel that some people are trading in one addiction for another. Could you talk a little about that as well?
Yeah, so that's a huge misconception. These medications are life-saving, and they stop the cycle of use and withdrawal, and the cycle of incurring in illegal actions and the risk taken that takes place procuring street drugs, right? There are many people that are dying from accidental overdoses, from tainted heroin with fentanyl and other drugs. And so when somebody's prescribed this medication, all of that cycle stops, and they can now stabilize their life and engage in treatment and begin to engage in a journey of recovery.
Well, I'll tell you, that's very inspirational, because I know a lot of people who have this problem. There's so many impediments to getting better, and you've actually made it sound like there's some solid pathways to get help, and help is not only attainable, but it's a goal and it can be achieved. So it's very inspirational.
And may I just say a couple of things to this regard, which I think, so the abstinence model for opiates is not the standard of care, and the risk of withdrawal, the risk of going back into use is 60 to 80%, and the risk of dying is huge from an accidental overdose. So it is life-saving to get into medication-assisted treatment. And one last point I want to make is the distribution of naltrexone kits. Naltrexone is a medication that's an antidote for opiates, for opiate overdoses. So reverses an opiate overdose. And so the more we can put them out there, in the state of Louisiana, you don't need a prescription. You can go, any one of us can go to a pharmacy and request a naltrexone kit and get the education about it and use it. And for every 20 that we put in the street, the American Society of Addiction Medicine estimates that we're saving one life. So if we are prescribed opiates ourselves, our loved ones, or our friends, it's best to have an naltrexone kit available, because we don't know when that can be used and can save somebody's life.
Wow, that sounds like that's a pretty good ratio, that
Yes.
to be able to help so many people that way. Well, again, Doctor, thanks for spending some time with us. We really appreciate it.
Thank you so much for having me.
We'll be right back, and our Community Health Heroes report is sure to make you smile. We'll tell you why.